A presentation by the Kidney Transplant Support Foundation. The sad plight of the kidney patients. The National Hospital Dialysis Unit, a place of hope for the ever-increasing numbers of patients with kidney failure. Dr. Nazar elaborates on their plight.
What is the primary cause of kidney failure in your opinion?
Well, right now, Ajit, diabetes is taking the lead role in renal failure. In fact, recent studies in our country have shown it is between 30 to 40% of the end-stage renal failure population belong to diabetic group. And apart from diabetes, hypertension is also playing a major role. Put together, diabetes and hypertension contributes to about 65% of renal failure in this country.
Lots of people with diabetes are now going into kidney failure. Kidney failure, if untreated, necessarily causes death.
We estimate that we have got about 8,000 end-stage renal failure patients who require some sort of renal replacement therapy. Which we provide in two forms, that is dialysis or transplant. And as you know, transplant is a very tedious process, and you need to have a donor. It could be either a live related donor, or it has to be from a cadaveric program. We don't have a good cadaveric program. A country like ours, with the limited health budget and limited resources, I don't think government alone can provide this service without any discrimination to all the people who need dialysis.
Referred to Dr. Chula Herath at the Asri Hospital, where I had to go for treatment there and do my dialysis twice a week there, which cost me 5,250. In addition to the injections, about 3,000 rupees for every set, every sitting. And in addition to that also I had to spend for my traveling. So it cost me almost 9,000 for each sitting. So I had to do it twice a week, which was 18,000 rupees. And I had to do 8 to 10 times a month, depending on how the condition is.
The country has about 100 machines right now, that is including the private sector, that will cater to about less than 1,000 dialysis population. So considering this, our country's requirement for number of dialysis machine is about 1,000. So the rest have no access to dialysis, and they are poor from faraway areas like Anuradhapura, Polonnaruwa, or maybe even Hambantota. And access to dialysis is limited to few hospitals, and there are not enough experts around to provide a good service. More than that, it is the cost involved in dialysis for the government, and also to maintain with the daily burden of consumables, which comes to about 3,000 rupees minimum, because each dialysis, even for the government, cost about 5,000 rupees if you put salaries, wages and labor.
Dialysis is a renal treatment therapy needed for the very survival of those patients who suffer from both acute and chronic renal failure. In layman's terms, this is known as kidney failure. Dialysing means purification of your blood through the use of an artificial kidney. Blood is circulated through these consumables which are required for each session. These cost approximately 3,000 rupees a set, excluding overheads.
With more financial assistance or private sector involvement, to increase the number of dialysis machines at least as an interim measure, to give them few years of hope until they sort out their logistics, which may be finding a donor or sorting out their finances and so on. Because most of the time the shock of needing dialysis comes within a short period, because most of them are diagnosed kind of in a short period. They had been having this problem but not recognized. Apart from the few people of having diabetes or hypertension for a long period of time, the rest comes to us without any knowledge of that disease in advance. So people like those find it very difficult, first of all, to swallow the bitter pill of death. For we should have a kind of a infrastructure in different ways. One is to provide them shelter until they have access for dialysis in a place which is convenient to them. Then, of course, they should be provided with regular dialysis, not like this ad hoc manner once in a way. That is not acceptable in dialysis. You need to provide at least 2 or 3 times a week decent dialysis for a considerable period before we decide in which direction to go for.
For those who do not recover, the facilities don't exist and they have to either rely on the private sector or they would actually die before a kidney transplant is performed.
I am sure there are examples set in India and Pakistan where the private sector has done a wonderful service in providing a parallel service to the government sector service in bringing this burden down on the suffering population.
Each patient has to spend a minimum of 50,000 rupees a month for dialysis, and this excludes additional medicine that is needed. Due to the shortage of dialysis machines in the government sector, this is the amount a kidney patient is forced to find in order to undergo dialysis in the private sector.
And those reports are very costly. And finally, the situation was so bad that I had to approach even certain people for help. And then what I thought was that I even thought of selling my property to continue with my treatment because I could do a kidney transplant. It is very costly.
How has this affected your family? Do they?
Well, it has affected them very badly because the moment I spend this money, I come home and I keep thinking of the next treatment, that I have to find the money for the next treatment. Then they too are upset over me, that I am worried and concentrating and all these type of things.
දැන් වාගේ වයස කීයද?
25.
right.
මම දැන් සාව කරන්න කලින් කරා. සාප්පු.
කොච්චර කාලයක් තව මේක කරන්න වෙයිද?
දැන් මොකද බද්ධ කරන්න බලාපොරොත්තු වෙන තමයි.
දැන් මොකද බද්ධ කරන්න කවුරු හරි ඉන්නවද දෙන්න කෙනෙක්?
දැන් තාම වෙන ඔක්කොම බද්ධ කරන්න. මේ හිතවල පරීක්ෂණ වලට ගොඩක් තියෙනවා. ඒ වලින් තවත් අය උදව් කරන මේකෙන් තමයි නැත්තම් ටිකක් ගොඩක් අමාරුවෙන් තමයි.
Kidney failure knows no barrier and could strike anybody, regardless of gender, age or ethnicity. 25-year-old Mahesh has no chance to live unless he finds a donor, as he cannot afford to live on dialysis for the rest of his life. Sadly, there are no guarantees that he will find a donor. Chitra also prays for a transplant, without which she will leave behind 3 young motherless children.
And the only way we can treat them is to attach them to a dialysis machine, hemodialysis, and that goes on till the kidney recovers, as it happens in some people, and then they get back to normal life. Or in others, the kidney failure never recovers, and they need to be either on hemodialysis for life, or the better alternative, the more cost-effective alternative is to have a kidney transplant.
Kidney patients fall into 2 categories known as acute renal failure and chronic renal failure. Acute renal failure needs only limited dialysis treatment, which enables the kidney to rejuvenate on its own.
While the problem of acute renal failure is being sorted out by hemodialysis, our main problem is what to do for these people with chronic kidney failure.
Unfortunately, those with chronic renal failure need dialysis for the rest of their life unless a transplant is possible. Many do not survive due to the lack of a donor or the resources needed for continued dialysis.
Can we afford to keep them on dialysis for years? And that is not possible for financial reasons, and the facility at the moment is not available for these people.
Without dialysis, these patients have no hope, and an estimated 8 out of 10 patients die within 2 years due to lack of resources.
Now, kidneys are obtained from living related people, and the other alternative source is brain dead individuals, and this we call cadaver kidneys. It is not easy to find living related people who are willing to donate kidneys, and that's the reason why lots of people find unrelated donors and go abroad and get kidneys done, because we do not promote unrelated donors in this country. The others who don't have any donors would eventually die. Now, one might ask, why don't we find kidneys from cadavers, brain dead people? And that is a good possibility in this country, but to have a cadaver kidney program, you need to have well dialyzed, fit and healthy population of kidney failure patients who can be called upon at any time when such kidneys are available. Now, that is our biggest problem. So we are wasting a lot of kidneys from cadavers because we don't have a chronic hemodialysis program which would keep these patients alive and well until such kidneys are found.
A significant number of kidneys that could have been harvested from brain-dead patients have been lost due to the lack of a proper cadaveric transplant program. A dedicated dialysis unit could have saved the lives of many patients by keeping them fit to receive such kidneys. With only approximately 80 machines available in the public sector and over 1,000 machines needed in the country, the government sector is unable to cope. In addition, Sri Lanka neither has any transit home nor dedicated dialysis center to service a proper kidney transplant program. With the hope of addressing this issue, the Kidney Transplant Support Foundation was set up to initiate a cadaveric transplant program by providing the required dialysis machines that are needed to accomplish this. It works in close collaboration with the Kidney Patients Welfare Society, which was founded by Mrs. Janet Gunasekara in the year 2000. Having donated the dialysis unit of the Kalubovila Hospital, they have already secured donations for over 20 dialysis machines and hope to establish a transit home cum dialysis center for low-income patients. This will be the first of its kind in Sri Lanka.
Now I got an opportunity of using this unit, Kalubovila Hospital, which is a great thing, I would say, wonderful. And it's quite clean and nice, and I would like if this is developed more and more, with more machines, better beds and other facilities.
These patients hope and pray for recovery, and the only means that keeps them alive is dialysis. With continually increasing numbers in both acute and chronic renal failure, the country requires as many dialysis machines and centers as possible. The Kidney Transplant Support Foundation as well as the Kidney Patients Welfare Society are entirely dependent on well-wishers for its work. While they engage in fundraising events, they require substantial donations from well-wishers to accomplish the ambitious projects that need to be carried out. The foundation also plans to educate the loved ones of potential donors to grant consent for organ harvesting so that another may live. They also propose to develop a database for donors and recipients so that it would facilitate the transplanting process. Please donate generously. Tomorrow, it could be you or a loved one.